This morning now to Gene with a big story about drug shortages here in the Boston area.
Yeah, Shannon, thank you. Picture this. You go to the pharmacy to pick up a drug that will prevent breast cancer from spreading to other parts of your body, and you're told there's a shortage of that drug. You can't get it, and you're actually turned away. Or you're a doctor in the ER, and you reach for a life-saving treatment and see that it is in limited supply. It's happening here in New England and nationwide. Critical drug shortages that are leaving patients and doctors frustrated and angry. Joining us this morning is Dr. Daria Long. She's an emergency room doctor at Beth Israel Deaconess Medical Center, an instructor at Harvard Medical School. And Dr. Daria, I know you've been doing a lot of research into this. What are you finding by looking into this, and what are the biggest issues we're dealing with here?
You know, Gene, I have, and I've been seeing it in the ER and with prescriptions, and some drugs are just not available.
Well, I know you invited us into the ER to get a closer look at how this is actually playing out, so let's take a look.
The majority of drugs in critical shortage are injectable medications. That means special antibiotics, cancer medications, and emergency heart resuscitation medications. Now, you may not know what those are, so to give you some context, I wanted to bring you to a place that we use them on a daily basis. I'm in the emergency department at Beth Israel Deaconess Medical Center, where I work as an emergency room doctor, and we're in the critical care room, where we see our sickest patients. In here, seconds count, so we keep our life-saving medications close at hand in what we call a code cart. Now, what you may not know is that over the past year, 60% of these medications have experienced nationwide critical shortages. And the causes are complex. They include manufacturing problems and contamination, regulatory issues, and the fact that these are generic medications and don't represent high profits to the manufacturers. Let me give you some examples. We have here 2 cardiac arrest medications, or what I would reach for if somebody's heart were to stop beating: epinephrine and atropine. They're both in limited supply, but atropine can't even be purchased at times, so the current supply that we have may have to last us until it's available again. We also have some of our standard pain medications here: Dilaudid, morphine, lidocaine, Valium. You may have heard of some of them, and they're all in critical shortage. Some are only available in certain doses, others are not available at all. And these are just a few of the many medications with critical shortages nationwide. Fortunately, doctors and pharmacists here and at other hospitals are working around the clock to find solutions to the problem so we can continue to protect patient care. But I'll tell you, it continues to be a constant challenge to make sure that every patient has the life-saving therapies that they need.
So, Dr. Daria, if you're a patient, you go in, you expect if you're having a heart attack or something, that drug is going to be there. And you mentioned sort of a business aspect of it, that some of these drugs aren't profitable enough. Is that the main reason we're in short supply now?
You know, there's really complex reasons. One of them is that they are generic medications, so they have low profit margins. But a big problem is just that there's a couple of manufacturers for a lot of these drugs, and they have some contamination issues, and even the FDA may have shut them down, and they have to take some time offline to fix a manufacturer.
So how long generally is it going to be before these things become readily available again? It seems like if there's a shortage, that they may want to get back and doing this quickly, but again, being a shortage, it indicates that maybe they're not getting back online and getting back to making these drugs as quickly as they should be.
Exactly, and some of them it's hard to say exactly how long it will take. There's some good news in that there's new legislation that requires manufacturers to alert the FDA before they just stop production. So we have time to figure out some other solutions and some other alternatives.
Some of the drugs you mentioned there in the ER, are there other drugs that are facing similar problems?
There are. We're seeing a lot of problems with cancer medications. They're actually having to import some of them from Europe to get enough supply, and also outpatient prescriptions such as those for ADHD, pain medications, some antibiotics, and even things like vitamin B12 injections.
Are these experiencing the shortages everywhere? Is it around the world? I know we're getting some from other places, but is this a common thing in other parts of the world too?
Well, what makes it so complex is that in the U.S. is where we're experiencing the real nationwide shortages. Every hospital or pharmacy has their own supply, so what's short in one pharmacy may be different from what's short in the one just across the street, depending on how they could get their extra stock.
So if you're a patient, what are you advising your patients who may need some crucial medications for them, yet they can't get their hands on?
The good news is that there are several things that patients can do. Number one, take your prescription list, go to the FDA drug shortage website, see if anything's on there for your prescriptions. 2 is have a conversation with your pharmacist. They have so much information, and they can really tell you if there are some medications that they're actually having trouble getting, and then find out what doses, what formulations. Some people will find out that their size pill isn't available, but a smaller pill and a larger of the same medication is, so they can do that.
Lastly and quickly, a lot of people will turn to the internet for solutions, and they may buy drugs from other places they don't really know where it's coming from. Is that a wise idea?
I don't think that's a wise idea. We don't know, like you said, we don't know where those are coming from. The FDA and our doctors are there to protect us, so have a conversation with your doctor.
All right, very important information. And for more information, you can go to your website, drdaria.com. Check it out there. We do appreciate coming in this morning.
Thanks,
Dr. Daria Long joining us here in our Dedham studios. We have to take a break. We'll continue the Fox 25 Morning News in just a moment.